Magandang araw po. Ako po si Maika, isang Infection Prevention and Control Nurse. Kami po sa Infection Prevention and Control Unit ay naghahangad na mapalawig ang inyong kaalaman patungkol sa Mpox. Sa ating orientation po na ito, kasama po namin ang ating Dermatology Department na magdi-discuss po later on regarding the proper specimen collection at ang ating Pathology and Laboratory Department para mag-discuss naman po ng completeness ng CIF and proper handling of specimen sa kabuuan ng ating orientation for the Mpox guidelines. At para bigyan po tayo ng linaw kung ano po ang napapaloob sa Mpox guidelines 3rd edition, I will lead you to Ms. Karen Cruz de los Santos.
Thank you, Maika! Magandang araw po sa lahat. Ako si Karen Cruz de los Santos, Infection Prevention and Control Nurse. So ano nga po ba ang Mpox? Ito ay na-discover noong 1958 nung magkaroon ng dalawang outbreak ng pox-like disease ang mga unggoy. Kaya ito ay unang pinangalan ng monkeypox. Ang Mpox virus ay isang envelope double-stranded DNA virus na kabilang sa orthopoxvirus genus of the Poxviridae family. Ito ay may dalawang clade, Central African Congo Basin o Clade 1 at West African Clade or Clade 2. Ang Clade 1 ay nagmula sa Central Africa, particularly sa Democratic Republic of Congo. Ang Clade 2 naman ay mula sa West Africa, tulad ng sa Nigeria. Ang Clade 1 ay mas malala at may mas mataas na porsyento ng kamatayan, nasa 10%, habang ang Clade 2 ay may less severity kumpara sa Clade 1. Ang fatality rate nito ay nasa 1% lang. Ang Clade 1 ay may mas malalang sintomas tulad ng mas maraming skin lesions and systemic involvement. Habang ang Clade 2 naman ay may lesser symptoms like mas konti lang ang lesions at mas madalang ang systemic involvement nito. Ang Mpox outbreak noong 2022 na kumalat sa labas ng Africa at sa buong mundo ay Clade 2. Ayon sa DOH, ang Clade 1A ay endemic sa Central Africa mula pa noong 1970s. Ito ay naipapasa through animal to human at mas malala at mas nakakamatay. Ang Clade 1B naman ay recently evolved. Ito ay ang current outbreak sa Democratic Republic of Congo at ang mga kalapit na bansa. Human-to-human transmission ang pagkakahawakan nito. Habang ang Clade 2A, ito ay endemic sa West Africa since 1970s. Mababa lamang ang naitalang kamatayan. Ang 2B naman ay recently evolved. Nagka-global outbreak ito noong 2022 at ito ay naikakalat sa pamamagitan ng sexual networks. Dumako naman tayo sa mode of transmission. For the direct contact, nagkaroon ng direct skin-to-skin contact sa mga rashes or scabs ng mga taong infected with Mpox. Kung kayo po ay may exposure sa laway, upper respiratory secretions like sipon o plema, and iba pang body fluids. Ang mga buntis ay maaaring makahawa sa baby na habang nasa sinapupunan pa lamang nila, habang pinapanganak o pagkapanganak. Maaari itong maipasa through hugging, massaging, or kissing. Ganon din kung kayo ay matagal na nakipag-usap o may isinagawang aerosolizing generating procedure tulad ng autopsy, bronchoscopy, CPR, dental procedures, manual ventilation, etc. Maaari din pong maipasa ang virus through animal to human. Kung kayo po ay may direct exposure sa dugo, body fluids, or mucosal lesions ng mga infected animal. Maaari din po kung kayo ay nakagat, nakalmot, o nagalusan or kumain ng infected animal. Vehicle board po kung kayo ay may exposure sa mga articles na nagamit ng mga infected individuals na hindi na-disinfect tulad ng mga damit, kumot, towel, sex toys, or fetish gears. Case definition naman po tayo. Suspect case po ang tawag natin kapag kayo po ay may close contact sa isang probable or confirmed Mpox case in the first 21 days bago lumabas ang signs and symptoms. Plus, kayo ay may lagnat, masakit ang ulo, masakit ang katawan, nanghihina o hinahapo, at may hindi may paliwanag na skin rashes, singaw o namamagang kulani. Ang skin rash po ay maaaring isa o higit pa sa mga sumusunod. Lesion sa anogenital region o sa kahit saang parte pa ng katawan, marami or malalaking singaw, lesion sa bibig, mata, ari o anorectal area, anorectal lesions, pamamaga, masakit o pagdurugo nito. Mga rashes na mula sa tigdas, bulutong, syphilis, bacterial infections, or allergic reactions, halimbawa sa mga halaman or any other locally relevant common causes to papular or vesicular rash. What you can view now on your screen is the Mpox lesion progression and timeline. For 1 to 2 days, appearance of macules. Ito ay flat at may discoloration. Next is papules. For 1 to 2 days, ito ay slightly raised na medyo matigas. Next naman ay vesicles. Ang lesions po ay may clear na fluid sa loob at ito ay tatagal ng 1 to 2 days. Susundan naman ito ng pustules. Sa loob ng 5 to 7 days, ang lesion ay may madilaw na fluid sa loob. Ito ay nakabukol, matigas at bilugan. Thrushing naman po ang susunod. In 7 to 14 days, ang mga lesions ay maglalangib at makati. Probable case naman po ang tawag kung may mga sintomas na aking unang nabanggit plus one or more of the following. If kayo rin po ay may epidemiological link or face-to-face exposure tulad ng healthcare workers na walang proper respiratory protection, may direct skin-to-skin contact or skin lesions including sexual contact, or nagkaroon ng direct contact sa mga contaminated materials, samples po in the meat, kumot, or pinagkainan ng mga probable or confirmed case of Mpox sa first 21 days before lumabas ang sintomas. O nagkaroon ng multiple sexual partners, dalawa o higit pa, in the first 21 days before onset of symptoms. Confirmed case naman po ang tawag natin sa suspected or probable case na nag-positive result ng lesion swab RT-PCR. Close contact case po kung kayo ay na-expose from the time na unang lumabas ng mga symptoms hanggang sa time na nagpo-fall off na ang mga langgigang sugat. At kung meron pong isa o higit pang exposure sa probable or confirmed case of Mpox. May face-to-face exposure kasama dito ang healthcare workers na hindi naka-appropriate PPE, may direct physical contact, sexual contact, or direct contact sa mga contaminated articles tulad ng damit or kumot. For the Mpox precautionary measures, it could be transmissible po through contact, and with aerosolizing procedure, airborne naman po ito. Let us now proceed for the recommended personal protective equipment. In case we will be having a close contact for an Mpox case, we must wear surgical mask, shoe cover, impermeable gown, cap, apron, and properly fit gloves. Gloves na hindi too tight and not too loose as well para we are comfortable wearing it. At kung tayo naman po ay magsasagawa ng aerosolizing procedure, we need to wear eye protection such as goggles and face shield, and a fit-tested N95 mask. On your screen is the interim guidelines on the prevention and control of Mpox. Ito po ang appropriate infection prevention and control measures and personal protective equipment per area or activity. Ang ating mga entrance guard, triage or screening area, close contacts without aerosolizing generating procedure, close contact with aerosolizing generating procedure, and surgical procedures need to perform thorough hand hygiene. Face shield and goggles must be worn if we are in close contact with or without aerosolizing generating procedure and surgical procedures. The entrance guard, triaging or screening area, close contacts without AGPs must wear medical or surgical masks, wherein the persons in close contact with AGPs and if for surgical procedure, they must wear respirator masks. Disposable gowns and disposable gloves must be properly worn by the close contacts with or without aerosolizing generating procedure, and if with surgical procedures. Head cap should be worn during surgical procedures. Shoe cover must also be worn if the Mpox case will undergo surgical operation. If for close contacts with or without AGPs, they must wear washable shoes. Let us now move on in managing process. Ito ang ating infectious foot walkway plan. This is designed po to manage and minimize the spread of infection. Ito po ay controlled pathway ng mga patients na infectious case. This plan po involves designated walkways, This is to ensure po the potential contaminants are contained and ma-minimize po ang movement. Ito po ay para proteksyonan ang ating mga vulnerable patients, yung mga mabababa ang immune system. Example po, ang mga cancer patients po natin. If you may look po sa color ng footprints, yellow po for the new patients going to triage. If they are identified as clean or non-infectious case, makikita po ninyo na ito ay mag-green color green. Or if they are identified as infectious Mpox case, you'll see po na magiging red yung footprint. Diretso po ito sa isolation room or sa holding area kung sakaling may patient po sa isolation room. While waiting po ito mabakante or iaakit na po siya sa P-Ward 2 isolation room. Ang mga suspect cases po na pupunta sa Emergency Service Complex Triage, meron po tayong Mpox virus infection checklist form. Ito po ang magiging assessment guide ng ating mga triage officers. Part po ng checklist if may skin rash po ba si patient. Then if it's answerable by yes or no, if yes po, proceed po for the next question. Ang patient po ba ay may headache, fever, namamagang kulani, masakit ang katawan, or nanghihina? Third question po, if may travel history po ba ang patient sa ibang bansa? Then po, for question number 4, if may history of contact with other persons with rash. Fifth question po, if may prolonged or close physical contact such as skin-to-skin or mouth-to-mouth contact siya from an individual in the past 21 days. And lastly, if may unprotected exposure to respiratory secretions or items used by confirmed or suspected case of Mpox. If may yes po na sagot sa numbers 2 to 6, patient must then be isolated sa isolation room or P-Ward 2 isolation room. Ito naman po is patient is from OPD. The suspected case po will assessed by the ESC triage using the Mpox virus infectious checklist. If yes po ang results, patient will be transferred to isolation room or P-Ward 2 isolation room. The JRMMC is considered third Mpox referral hospital, kaya asahan po natin na tayo ay makakatanggap ng referrals from other hospitals. If this happens, after po ng formal referral from the other hospital, patient will then be assessed sa ESC triage using the Mpox virus infection checklist. If the patient po is admissible, he will then be transferred to isolation room or P-Ward 2 isolation room.
Thank you po, Ms. Karen. So right now, i-discuss ko naman po ang special procedures regarding sa Mpox po. Then, we'll go on sa patient transport. If a patient po na suspected or confirmed po na Mpox case, nagre-require po ng transportation, hindi po pwedeng gumamit ng public transportation. Instead, we need to use an inpatient transportation within the facility. If for transport po ang pasyente, the patient must have their hand hygiene. Kailangan po malinis po ang kamay nila. And we need to provide po yung pasyente ng surgical mask if tolerated po ng pasyente. Kailangan po fully covered ang mouth and nose po ng pasyente para po ma-reduce yung risk ng spread ng respiratory droplet. And of course, we need also to cover yung lesions po ng pasyente as much as possible. We can use their patient's gown, clean sheet, or dry dressing, kahit po yung mga gauze natin, para lang po makover yung lesions, para po malimit natin yung contact with the environment. Second, we need to ensure po na yung receiving department or receiving facility ay aware po na may darating na pasyente sa kanila. We need to notify them ahead of time para po makapag-prepare sila sa arrival ng patient para po ma-implement yung proper isolation protocol. Most especially yung airborne and contact precaution bago po mag-arrive yung pasyente. Then third, we need to follow the foot pathway, simultaneously informing the security and housekeeping department. Yung foot pathway po, yun po yung diniscuss kanina ni Ms. Karen. So, we need to follow the foot pathway and i-inform po yung security department and housekeeping department para po ma-avoid natin yung high traffic areas. Para malimit po yung exposure ng pasyente sa ibang tao. Next naman po, ating patients for hemodialysis. So, kapag meron po tayong Mpox patient na kinakailangan mag-dialysis, we need to follow the standard precaution and of course the contact precaution. We need to avoid po yung skin-to-skin contact. And of course, sa mga pasyente naman po na magkakaroon ng aerosolizing procedures such as suctioning, nebulization, intubation, kailangan po tayo mag-adhere sa airborne precaution. We must strictly follow po para po sa ating mga patient na mag-undergo ng hemodialysis. Number 2 naman po, kailangan po yung mga staff natin wearing ng appropriate PPE. And they need to follow the protocols po ng cleaning and disinfection. Yung lahat po ng ginamit ng pasyente, surface, equipment po na nagkaroon ng contact sa ating pasyente, we need to follow the cleaning and disinfection process. Then next, dialysis is in an isolation room is the best option. Pero po, kapag po hindi available ang isolation room, patient could be scheduled at the end of the day rin po. So, halimbawa pong wala po tayong isolation room, pwede po siyang i-schedule at the end of the day. The next, the patient's skin lesion should be fully covered. Kagaya po kanina, dun sa ating patient transport, kailangan po covered ang lesions ng pasyente para po ma-reduce yung contact po sa ating staff or sa environment po. Patients for surgical procedures. Okay, paano po kapag meron tayong mga Mpox patients na kailangan ng surgical procedure? First of all, we need to assess the patient kung meron po siyang signs and symptoms ng Mpox. And kung may exposure po siya dun sa mga may Mpox before the surgery. So, halimbawa po, meron po tayong mga pasyente na may Mpox pero kailangan ng surgery. We need to assess po kung yung surgery is urgent or they can be delayed. So, for our elective surgeries po, this should be postponed at least 21 days from the exposure. Or until po yung lesion ay gumaling na, or until po yung rash ay nag-resolve na, or yung mga scabs po ay nag-fall off na. Pero paano naman po kung kailangan niya ng maoperahan? So if the surgery cannot be postponed, the surgery should be scheduled po at the end of the day then, when possible. Next po. So we need to use identified OR theater for Mpox and strictly wear po yung full PPE. So mag-a-assign po tayo or mag-identify po tayo ng dedicated OR theater para lang po sa procedure ng mga pasyenteng may Mpox po. Then of course, we need to minimize OR traffic. Ililimit po natin yung OR traffic para po ma-decrease yung further exposure po doon sa may Mpox po. And then, lastly, we need to have this rigorous cleaning, disinfection, sterilization ng mga equipments na ginamit and yung mga instruments na ginamit, and of course, the OR theater itself. We must strictly follow the cleaning, disinfection, and sterilization process. So, next, the proper cleaning and disinfection. Cleaning and disinfection procedures po, we need to clean and disinfect all the surface that were in contact with the patient, including the chairs, exam tables, washroom na ginamit ng pasyente. So, we need to focus po yung attention natin dun sa mga frequently touched surfaces, yung mga madalas hawakan ng pasyente, such as yung doorknobs, call bells, yung mga gripo, di ba, yung mga faucets, wall surfaces, sa CR, di ba? Lahat po ng frequently touched by the patient, we need to give our attention po dun sa cleaning and disinfection procedure natin. And then number 2, healthcare personnel po must wear proper PPE. ISO gown, yung ating gloves, fit-tested N95 mask, goggles, and yung face shield po. So third po is we need to strictly adhere on the proper cleaning and disinfection following our institution's guideline. So una po, kailangan po natin yung decontamination process using our 1:10 high concentration, using po yung 360 ml sodium hypochlorite and 3,800 ml of water po for 30 minutes po. So, during this decontamination process, kailangan po nakasuot po tayo ng complete PPE and wear po ng another gloves. Then after po ng decontamination process, kailangan po remove natin yung contaminated gloves bago po tayo go on to the next process, which is the cleaning process using soap and water. Still, kailangan po complete ang PPE natin and we need to wear another gloves. And then after this cleaning process using soap and water, we need to remove ulit po ang contaminated gloves. And then we'll go on again to the next process, which is yung rinsing naman po. Cleansing with clean water. So, next po is the disinfection process. Using naman po yung low concentration natin, which is yung 60 ml sodium hypochlorite and 3,800 ml of water. Yun po yung tinatawag nating 1:100. So still, with complete PPE, and we need to remove po yung contaminated gloves natin. And para po matapos natin yung proper disinfection, kailangan po ma-complete dry yung nilinis po natin. And then, of course, we need to doff strictly po. Next po is ating monitoring and isolation. So, sino-sino po ba yung kailangan nating i-monitor and i-isolate? Okay, we have these 3 classifications po. Close contact, yung kailangan po ng home isolation, and yung kailangan po ng hospital isolation. So, sa ating mga close contact, ito po yung mga exposed sa suspect, probable, and confirmed Mpox case. Kailangan po silang monitor or pwede po silang mag-self-monitor daily for 21 days kung may mag-o-occur po na signs and symptoms po sa kanila. They can continue their daily activities po as long as they are monitoring po dun sa mag-o-occur na signs and symptoms. Next naman po is yung home isolation. Ito po yung mga suspect, probable, or confirmed cases na mild lang, uncomplicated, and of course, hindi po high risk sa complication. So, ang pag-decide po ng pag-isolate sa bahay ay case-to-case basis. Sabi ko nga po, either mild, walang complication, kaya ng pasyente, ambulatory yung pasyente, and kaya niyang pangalagaan yung sarili niya mag-isa. So, at least 21 days from the onset ng sintomas until the lesions po ay completely healed or yung mga scabs po ay nawala na, or whichever is longer. So, yun po ang ating home isolation. However, ito naman pong ating hospital isolation po. Ito po para sa mga pasyente na high risk for complication. Katulad po ng mga bata, mga buntis, at yung mga immunocompromised patients. So, those with complicated Mpox should be admitted to hospital para po sa ating close monitoring and yung mga clinical care po. Next naman po yung ating EMS consultation, management, and clearance. So, if meron po tayong mga empleyado na may signs and symptoms ng Mpox, all healthcare personnel po na merong sintomas must report po sa safety officer po ng bawat area, unit, or department po kung saan po tayo napapaloob. And then, safety officer po ang mag-source out po sa telemed, care of ating family medicine for consultation, evaluation, and management, and of course, yung clearance po ng ating mga empleyado. So, si family medicine po, yung resident on duty niya, sila po yung magpo-provide ng proper management and disposition po na mangyayari po sa empleyado. Sila rin po ang mag-clear. So, our safety officer also, kailangan po mag-report sa infection control nurse dahil po ang infection prevention control nurse po ang magmamanage ng contact tracing, monitoring, and of course, reporting po sa Department of Health. So, sa atin naman pong contact tracing, meron po tayong dalawang approaches. Ayon po sa DOH to control the spread po ng infection. So, una po is yung backward contact tracing. And then, the next one po is forward contact tracing. Sa backward contact tracing po, ina-identify po natin yung mga pinuntahan ng pasyente or nakasalamuha niya within 21 days prior siyang magkaroon ng sintomas. So, sa forward contact tracing naman po, ina-identify natin yung movement ng pasyente, yung mga pinuntahan niya, nakasalamuha niya after naman po niya magkaroon ng symptoms hanggang sa ma-isolate po siya. Next po is classification of exposed risk and quarantine recommendation. So, ang exposure risk po natin ay classified into 3: high risk, intermediate risk, at low risk. Sa mga high risk po, ito yung mga taong na-expose na may sugat or break sa skin or mucous membrane po nila, na-expose po sa materials, skin lesion, or body fluids ng infected Mpox case. So, ito rin po yung mga close contact sa pasyente na nag-undergo ng aerosol generating procedure, na hindi po properly wearing ng respiratory protection po. So, ang recommendation po dito, kailangan po nilang mag-quarantine within for 21 days from the date po na na-expose sila, and kailangan po nilang mag-undergo ng active surveillance. Next naman po is yung intermediate risk. So, meron din pong direct contact ang intermediate risk. Pero ang pagkakaiba niya po sa high risk is na-expose po yung skin, yung exposed na skin po doon sa pasyente ay intact po yung skin niya. Wala po siyang sugat or wala pong break at hindi po sa mucous membrane. So another po classification ng yung sa intermediate risk is mga taong na-expose po within 6 feet pero prolonged period of time. So more than 3 hours of delivering medical care po na without proper PPE. So yun po, considered po sila as intermediate risk. Recommendation naman po sa intermediate risk, hindi po required ang quarantine, pero po kailangan nilang mag-undergo ng active surveillance. So, they need to observe po yung mga precautions also for 21 days from the last exposure. So, kailangan pong iwasan, i-avoid po ang contact sa immunocompromised people, sa mga buntis at sa mga bata. So, kailangan din pong i-avoid yung pag-travel hanggat maaari, mag-stay muna sa bahay during yung duration po ng active surveillance. And when the symptoms occur po, kailangan po nilang mag-isolate and of course, subject po sila for testing. Then the last po is the low risk. Ito naman po yung mga tao na parang casual or brief contact lang with the patient. Halimbawa, napadaan lang sila or na nakapasok sila sa kwarto ng isang pasyente nang hindi po sila naka-PPE pero wala po silang direct contact sa pasyente. So wala po, meron pong kumbaga wala pong hindi po sila masyadong exposed sa pasyente. Yun po ang kina-classify natin as low risk. So recommendation po dito, not required po ang quarantine, pero po katulad kanina, they shall continue po yung pag-observe ng occurrence ng signs and symptoms po. So, kapag po nag-develop ng signs and symptoms, we need to isolate them and of course, subject them for testing. And this will undergo po passive surveillance. Para sa kaalaman po ng lahat, ang Infection Prevention and Control Unit po ay nag-create ng mga official infographics and signages para po sa ating institution. So, ito po sila. For the Mpox symptoms, transmission po ng virus, and next po is yung gabay po para sa Mpox, paano maiiwasan yung sa hospital, community, and sa atin pong mga tahanan. Ngayon naman po, to give detailed information on how to collect lesions, RT-PCR, we would be passing the video to our dermatology department.